I don't want to breastfeed because it's going to make my breasts sag. So another common misconception is that you shouldn't use your hands to express your breast milk, but that you should rather invest in a pump. I tell you guys that hand expression is perfectly safe, but what I'm here to do is to help you hand express using the correct technique. So our breast model is back. So how do we hand express? What's important? So first and foremost, before we even start the actual process, we need to make sure that mommy is comfortable. She needs to be sitting in a position that she feels comfortable in. We also need to ensure that she's washed her hands and that all the utensils that she's about to use have been properly cleaned and sterilized. So now what? Now we need to activate the oxytocin reflex. So oxytocin is a hormone that's involved in the whole breastfeeding breast milk scenario. So oxytocin is the hormone that helps the milk come out. Prolactin is the hormone that produces the milk. So prolactin will help produce the milk, and then oxytocin will help the milk come out. So how do we stimulate this oxytocin reflex? Well, it's all about how the mom is feeling at that point. So what can we do? First and foremost, mom can be encouraged to think about her baby, or if she's going to be expressing at home and her baby's right there, she can be looking at her baby while she's expressing. Another thing that she can do is to use a warm compress on her breast. This also stimulates the oxytocin reflex, which helps with milk ejection. So another thing that she can do is maybe she can ask daddy to massage her, maybe massage her back, make her feel relaxed. So all of those things assist with the oxytocin reflex, and then the milk is ready, honey. The milk is ready to be expressed. So how do we do it? Take our thumb and we place it on the areola above the nipple, and then our forefingers will go underneath the breast. So we will create sort of like a C shape. So what now? We then pull toward the chest wall and press, release, go around, pull towards the chest wall, press, release, and we will continue this motion all around the breast. Okay guys, so once you've expressed your breast milk and you put it in your containers, so something that I've seen a lot of mommies doing is that they'll either get some glass jars, like maybe you can use like an old mayonnaise jar and clean it properly, and then you can store your milk in there, or you can use like little Ziploc bags and you can store your milk in there as well. Just remember, it's super important for you to date the milk so that you can use it accordingly. You don't want to find yourself using the newer milk before the milk that was there before. Okay, cool. So now that we started speaking about storage, I think it's important for us to touch on it. So at different temperatures, your milk can stay for obviously various amounts of time. So firstly, at room temperature, the breast milk can stay from 6 to 8 hours, and what's recommended is that you keep it in a dark, cool place. So you don't want to put it in direct sunlight or in a super warm environment, because obviously your breast milk will curdle and then you will have to discard it. Then in the refrigerator, it can stay up to 6 days. So when it's in the refrigerator, the recommendation is that you try put it at the back of the fridge, because that's obviously the coolest place in the fridge. And then we have our freezer that's connected to the fridge. So there your breast milk can stay up to 3 months. Remember, label your milk. What's important now is once your milk is frozen, how do we defrost it? You never ever put breast milk in the microwave. You will destroy the nutrients immediately. Then it defeats the point of what we're trying to do. So when it comes to defrosting your breast milk, you can either take it from the freezer and allow it to defrost at the fridge, or you can take it out completely and keep it at room temperature. It can stay there for up to 12 hours for it to defrost, but once it's defrosted, then you need to utilize it within 8 hours. If that period misses you, or all the milk that you've defrosted, some of it is left over and it's been staying out for longer than that period, you need to discard that milk. Okay, then in the deep freezer, it can stay for from 3 to 6 months. In terms of defrosting, the same procedure applies as it did with the freezer that's connected to the fridge. Another question was, is there an ideal position for you to breastfeed your baby? Like, is there one position? Because I keep talking about correct positioning and correct attachment. So are we saying that there is one ideal position for breastfeeding? So definitely there is a position that is most common, which is the cradle hold, and it's most common especially when your baby's just born, because they don't have a lot of neck support, so you need to fully support them. So this is why this is the most common position. Let me show this position to you guys real quick, guys. So this is my little lactation doll. So I just want to demonstrate the correct positioning of the cradle hold. So this is what you need to look at. So first of all, you need to make sure that your hand is supporting baby's bottom. Then you hold your baby in a 90-degree angle. The head needs to be supported here. You know, this indent here by your arm. So the head is supported there. You're holding your baby at a 90-degree angle and you're supporting the bum bums. What's next? You need to ensure that your tummies are touching, which is what we call tummy to mommy. There's our baby, and if you'd like, you can get a pillow or something to put underneath here to support your baby. And then you ensure that your baby's mouth is wide open so that they can then latch onto your breast. They do not hold the nipple, they hold the areola. So a bit more of it will show at the top, and then your baby's nose would be right above your nipple, and then the baby will breastfeed. So this is the most common position, and it's super ideal for your newborn babies. There are other positions. There's a position called the football hold, for example, where the mommy would hold the baby like so, and the baby would then breastfeed. And what's really nice about this position is when you have twins, you can have your one baby on this side and your other baby on the other side. So this is called your football position. There's also the lying down position, where the mommy would be laying down and the baby would be breastfeeding. That is ideal for maybe mommies that have had a C-section and she may not want to put a lot of pressure around this abdominal area. But guys, what's important is that A, the mommy is comfortable, but B, what is most important is that the baby is properly latched and feeding accordingly. So those are the positions for your breastfeeding. Another question that's also really important is that, can an HIV positive mother breastfeed her baby? So the answer to this is absolutely. An HIV positive mom can totally breastfeed her baby. So what's important here is that mom gets the appropriate counseling. You need to make sure that mommy is going to be adherent to her treatment, as well as adherent to giving the baby treatment at the appropriate times. And then therefore, the mommy just does exclusive breastfeeding for the 6 months like an HIV negative mom. Then from 6 months, she introduces solids like an HIV negative mom. And then with HIV positive moms, they can breastfeed up to 2 years. So the final thing that we're going to address, and something that I hear so much of, is I don't want to breastfeed because it's going to make my breasts sag. Is it true? Is it not? First and foremost, guys, breastfeeding doesn't make your breasts sag. It's the pregnancy. Pregnancy may potentially make your breasts sag. And why do we say this? While you're pregnant, the whole beginning of the milk production starts to take place, and your breast tissue grows, your breasts become big. So what happens is that obviously the skin has already stretched. So whether you're gonna breastfeed or not, if genetically you are inclined to have breasts that may sag, that's what's going to take place. Because guys, let's be honest, how many women have 3, 4, 5 kids that they've either breastfed or have not breastfed? Their breasts don't sag. It's genetics. Do you know what I mean? Like, if genetically you guys just have good breasts, you're going to have good breasts. If genetically you're more likely to get sagging breasts after like that stretching of your boobs and the tissue growth while you were pregnant, then that's what's going to happen, irregardless of the fact that you will breastfeed or not. Another thing that's important is excessive weight gain during your pregnancy. If you gain a lot of weight during your pregnancy and then you give birth and you start to lose the weight, what happens generally with weight? You may have loose skin, which means that can also play a role in you potentially having saggy breasts. So I hope this dispels the myth. It is not the breastfeeding, it is the pregnancy. If you are that against having sagging breasts, you may want to think twice about falling pregnant. So yeah guys, but anyway, that is the end of this video. I hope you enjoyed it. I hope it was informative, but most importantly, I hope you guys understand. If you have any further questions relating to breastfeeding or complementary feeding your baby, please do leave them down below. I would love to make this a segment that we have on our channel every now and then. So if you have any further questions, please let me know. Or if you enjoyed the video, or if you have any suggestions, please let me know. But from me, that's the end of the video. I hope you enjoyed it. I'll see you guys on Monday. This was a bonus video for Saturday, but I'll definitely be seeing you guys on Monday. Love you.